India, world's second largest populated country, is on the verge of a population explosion. People here are running around, unmindful of the likely problem within. See these youngsters closely. They are the future of our great nation. Looking at each of these human beings from outside, one may think that they are capable of enduring anything and everything that comes their way. Some feel life will be one smooth sailing with no ups and downs. Many of them may not even have the slightest inkling that they may be harboring the deadly disease of hepatitis B and C, which may manifest itself anytime in life.
Hepatitis B infection is actually quite common in the community. There are certain parts of the world where this infection is prevalent in up to 15% of the people. In India, about 4%, that is 4 of every 100 people walking on the streets, have evidence of this infection by a test called hepatitis B surface antigen. Everybody is not going to go into developing liver cirrhosis or a complication, but quite a few would. And that is the reason why it's very important to know who are infected, how to prevent the infection, and to make sure that those who are likely to go on to developing disease.
Liver is one of the most important organs of our body, which helps in digestion and assimilation of nutrients. It processes nutrients to give life to our body. It repairs diseased and damaged tissues and eliminates toxins from getting into blood that flows to all our body cells. Besides that, it stores vitamins, minerals and starch for future use. Unfortunately, many people who are concerned about their health overlook the health of their liver. Hepatitis B is a dreaded disease, a silent killer. It has been there in the country for years. Awareness has come in recent times. Due to lack of public awareness, it has not received the same attention as AIDS, though hepatitis B is the larger killer in India than HIV.
Hepatitis B is caused by a very small germ, the hepatitis B virus. Once this germ enters the body, it goes to the liver where it settles down, and over many years it gradually nibbles away at the liver cells. Ultimately, it produces a disease called liver cirrhosis, which ultimately leads to liver failure. This is the reason why we are so worried about this viral infection. Also, when it is there in the liver for many years, it can produce liver cancer. This hepatitis B viral infection is actually quite common in the community. It's 10 times more common than HIV. And the number of deaths due to hepatitis B is at least 20 times more than due to HIV.
B, C, D and E. Hepatitis A and E are spread through contaminated food and water. A person infected with A and E viruses can recover completely within 6 months with proper medication and rest. In case of hepatitis B and hepatitis C, the infection is spread through infected blood and other body fluids. Hepatitis B is the inflammation of liver caused by hepatitis B virus.
Hepatitis B virus, when it has been there in the liver for a long time, it produces liver cirrhosis.
Hepatitis B infection is caused by unsafe blood transfusion, use of unsterilized needles for vaccination or injection, use of unsterilized needles for ear and body piercing, tattooing with unsterilized needles, use of used blades at a barber shop. From a hepatitis B positive mother to a newborn at the time of delivery, use of unsterilized equipment during dental extraction procedures, marrying infected person through unsafe sex. It is time now to dispel some of the common myths about the virus of hepatitis B. It is not spread through air, food and water. It does not spread through coughing, sneezing, hugging, sharing utensils or drinking glasses, eating food cooked by a hepatitis B positive person.
An interesting thing about hepatitis B virus infection is that it is often asymptomatic, that is having no symptoms associated with it in over 85% of people having this infection. The infection is discovered incidentally when blood is tested for things like a health checkup or for visa examination purposes in certain parts of the world.
Some people may, however, have nausea, lack of appetite, tiredness, fever, dark urine and yellowing of skin and whites of eyes, fluid in abdomen and swollen feet. Sometimes the veins of the food pipe are swollen and they rupture due to pressure. This may cause blood vomiting and black-colored stool.
When this infection occurs in a person who is 15 years or older, more than 90 to 95% of people are able to get rid of this infection completely with the help of their own defenses. Just like when you get a common cold or a viral infection, it clears up in a few days. However, if this infection occurs at a young age, say for example in a child at birth, during infancy or the preschool years, the rate of chronicity is much higher, and between 80 to 90% of such individuals will have lifelong infection.
Prevention is always better than cure. Since the disease is fatal, it is important to prevent a catastrophe by taking some precautions, such as getting blood from a reliable blood bank, where it is screened properly.
On one hand, blood can save precious life. On the other hand, if not tested properly or it is from unsafe sources, it can transmit diseases like hepatitis B, C and HIV infections. So we have to take care that the blood we are using for transfusion is from the safe donors, that is voluntary blood donors, and blood is screened by a good technique to rule out all these infections.
It is important to make sure that the disposable syringes are discarded after giving injections and not reused. Never use blades, toothbrushes and sharp objects used by others.
Hepatitis B virus affects people from all classes. It is not necessary that only the underprivileged or the poor get affected. Any class can get infected and the disease can affect the person.
Pregnant mothers should be tested for hepatitis B to prevent the infection from being transmitted at the time of delivery. And if the mother is positive, the newborn should be vaccinated within 12 hours of birth by giving first dose of hepatitis B vaccine and 1 dose of HBIG, followed by 3 doses of hepatitis B vaccine starting at 1 month of age. Vaccine is available against hepatitis B infection.
The best way to prevent hepatitis B virus infection is to take vaccines against it. The vaccine has to be taken in 3 doses. The first dose, then after a 1 month the second dose, and after 6 months the third dose. 3 doses of the vaccine and there is a 95% chance that you won't ever get this infection in your life. Nowadays, this vaccine has become very affordable. You know, it costs 20 rupees per dose of the vaccine, which means that for 60 rupees, 3 doses, you can have a lifetime of protection from this infection.
Those who get infected due to any reason and come to know about it can consult a doctor and protect themselves against the infection. There are effective medicines available for treatment if the disease is diagnosed in time.
Hepatitis B is both preventable and treatable. There are at least 6 medicines in the market which are effective for treating hepatitis B by chance if somebody has already got the infection. So the message today is that prevent hepatitis B, but don't get scared of it.
For more information, contact Health Promotion Cell, Department of Gastroenterology, Sanjay Gandhi Postgraduate Institute of Medical Sciences, Rai Bareli Road, Lucknow.